As Professor of International Health at University of East London, I had the privilege of giving a talk on the importance of plumbing to global health at the 9th World Plumbing Conference in Edinburgh, Scotland in 2011. This video presents an updated summary of key data and information from that lecture. In 2007, the British Medical Journal ran an interesting competition. They invited readers to vote for the most important medical milestone since the forerunner of the journal was first published in 1840. More than 11,300 readers of the BMJ chose the introduction of clean water and sewage disposal, the sanitary revolution, as the most important medical milestone since 1840, followed closely by the discovery of antibiotics and the advent of anesthesia. Britain led Europe in the sanitary revolution, and the contribution of two men to this movement was particularly significant. We must remember that this was an era when gastrointestinal disease was thought to be airborne and due to miasma or bad air. But John Snow, a surgeon in London, suspected that cholera was in fact waterborne. He was able to prove his views during an outbreak of cholera in 1854 in a part of London called Soho. He plotted cases of cholera on a map and found that they appeared to be concentrated around the Broad Street pump. It was the deaths of a widow and her niece, who lived some distance away in Hampstead, which finally confirmed his views. He discovered that the widow was partial to water from the Broad Street pump and had it regularly delivered to her house in Hampstead. Snow then asked for permission to remove the handle of the Broad Street pump, and the cholera outbreak subsided. The champion of the sanitary revolution is Edwin Chadwick. It was his conviction that sewers rinsed by water would reduce gastrointestinal disease and his efforts to develop the technologies and the necessary legal and administrative instruments that established safe water supply and sanitation systems in England. Imagine the disruption that is likely to have occurred in busy cities as a result of the laying down of these large sewers, as shown in this picture of Fleet Street in London. But what a major breakthrough that was for public health. By the early part of the 20th century, deaths due to diarrhea and dysentery had subsided significantly in many parts of Europe. Sadly, though, despite our understanding of the causation of waterborne disease, many countries continue to lack access to safe water and basic sanitation even today. A study of the global burden of disease attributed 1.8 million deaths in 2001 in low and middle income countries to diarrheal disease. Unsafe water, sanitation, and hygiene accounted for the majority of these deaths and highlighted the enormous health gains that could be made if the sanitary revolution could be extended to all parts of the globe. In the year 2000, 189 developed and developing countries signed up to work together to achieve 8 Millennium Development Goals to rid the world of poverty, illiteracy, hunger, and disease by 2015. The Goal 7 was to halve by 2015 the proportion of the population without sustainable access to safe drinking water and basic sanitation. In terms of access to safe water, the MDG report of 2010 suggests that the world is on track to meet the drinking water target, although much remains to be done in some regions. As illustrated by this bar chart taken from that report, Oceania and Sub-Saharan Africa still have a way to go to achieving this goal. Rural areas too remain at a disadvantage in all developing regions, and the proportion of people who enjoy the health and economic benefits of piped water is more than twice as high in urban areas as in rural areas, 79% versus 34%. Globally, 8 out of 10 people who are still without access to an improved drinking water source live in rural areas, and rural women continue to trek long distances to fetch a pot of clean water. But urban areas too are struggling to meet the demands of rapidly growing urban populations. A WHO report of 2006 highlighted that Dhaka in Bangladesh needed 1.6 billion litres of water daily to provide for basic needs, but only 1.26 billion litres were actually supplied. Besides, nearly all the water comes from deep underground sources and the water table is being rapidly lowered, so the source is not sustainable. And to add to that, there are many illegal connections to the sewer, which discharge industrial waste, including heavy metals. This means that the sewage cannot be used as fertilizer or for aquaculture.
Against this background, climate change research has highlighted that more areas than before may become prone to drought in a warmer climate in the next 50 years. Drought related to climate change may lead to decreased crop yields and hence food shortages and an increase in food prices. It is estimated that the number of hungry people in developing countries increases by 1% for every 2 to 2.5% rise in food prices. Drought may also result in greater vulnerability to infectious diseases as people start to drink water from any available source. It may also lead to population displacements and mass migrations with all the associated health risks that brings, such as overcrowding, lack of safe water, food and shelter, increased risk of malnutrition, and severe mental distress.
It is a little-known fact that drought particularly affects women. Women are the main producers of the world's staple crops, providing up to 90% of the rural poor's food intake and producing 60 to 80% of food in most developing regions. And yet drought results in reduced food security and severe undernutrition, particularly in women who are willing to deny themselves a meal in order to feed the family when there is less food on the table. Women and girls in many developing countries are responsible for collecting and fetching the family's water. They now have to walk longer distances to fetch safe water, leaving less time to contribute to paid work and resulting in halving of the household income.
Moving on to the issue of sanitation, the United Nations Millennium Development Goal Report published in 2010 stated that half the population of developing regions remain without sanitation, and the 2015 target appears to be out of reach. Since its inception, the World Health Organization has defined sanitation as vital to global health. Disappointingly, the lack of sanitation facilities compels people to defecate in the open and dump raw sewage into precious water sources such as these, increasing the risk of infectious disease. A UNICEF report estimates that 1 gram of feces in untreated water may contain up to 10 million viruses, 1 million bacteria, 1,000 parasite cysts, and 100 worm eggs. Healthcare facilities need access to clean water to wash hands and to good sanitation to prevent the spread of infectious disease. Worldwide, it is estimated that 5% to 30% of patients develop one or more avoidable infections during stays in healthcare facilities.
Adequate sanitation encourages children to be at school, particularly girls. Access to latrines raises school attendance rates for children.
Sanitation is an essential component in emergency response and rehabilitation efforts to stem the spread of diseases, rebuild basic services in communities, and help people return to normal daily activities.
But is all this relevant only to the developing world? The developed world has had the benefit of access to safe water and sanitation for approximately 150 years. But can we be assured that nothing will jeopardize this in the future? Take the UK, for instance. It is commonly perceived as wet and green, but the population density is high and rainfall varies across the country. Therefore, for each person, there is relatively little water available, especially in the southeast and in some urban areas. A Guardian newspaper report from 2008, drawing attention to the risks of wasting water, pointed out that nearly half of the population of England and Wales now live in areas of water stress, where supply might not keep up with demand, a problem usually associated with the parched regions of North Africa or the Middle East. The Environment Agency map confirms the alarming levels of water stress already being experienced in England and the urgent need to mobilize communities in efforts to conserve water.
Climate change is not only associated with water stress, it is also resulting in extreme weather events and an ever-increasing risk of disasters such as floods. The severe flooding in the summer of 2007 in England devastated large parts of the country, left 13 people dead, and caused billions of pounds worth of damage. The Pitt Review, which examined the lessons learnt from the floods, highlighted that in some of the affected counties, the situation resulted in the biggest rescue effort in peacetime Britain. In one county, 350,000 people were left without mains water supply. This was the most significant loss of essential services since World War II.
In 2005, even the most powerful country on earth, the United States of America, struggled to cope with the consequences of Hurricane Katrina, which left thousands of people in New Orleans struggling to survive without adequate food, water, shelter, plumbing, sanitation, electricity, and communications. The urgent and fundamental need for the developed world, too, to build its resilience to climate change impacts could not have been more clearly demonstrated. Can anyone doubt, then, the crucial importance of plumbing to public health? This WHO document on plumbing and health, published in 2006, recommended that the 3 roles a competent plumber must assume are to design, install, and maintain drinking water supply and waste removal systems, to manage the health and financial risks associated with plumbing, and to help conserve limited supplies of safe drinking water. In my view, the plumbing profession needs to recognize the crucial role it plays in improving public health by taking a more proactive role in planning and continuously improving access to safe water and sanitation, highlighting the impacts of climate change on access to safe water and sanitation, demonstrating leadership in planning and implementing climate change mitigation and adaptation measures, helping build capacity both in developing and developed countries, helping extend exemplary codes of practice, registration, and training to other parts of the globe, helping design improved systems for water supply, water conservation, stormwater drainage, sanitation systems, wastewater use, and the development of better plumbing materials.
The World Plumbing Council has a crucially important role in mobilizing its membership, policymakers, and communities to improve public health through safe water, sanitation, and climate change action. Despite the role plumbing plays in our lives, it is often not respected as an important contributor to public health in the developing and developed countries. The plumbing profession has a responsibility to change this by recognizing this crucial link and taking a more active part in planning for water and sanitation. World Plumbing Day is being celebrated on 11th March to raise awareness of these issues globally, to harness the expertise the profession can offer, and to promote closer cooperation between the profession and policymakers to improve our health and well-being.